My name is Tricia New, and I am an assistant professor in the Department of Nursing at Miami University. The title of the project that we are proposing for grant funding is Mindstrong, using cognitive behavioral therapy to increase emotional intelligence and decrease stress, anxiety, and depression in nursing students. So our project roadmap will begin with the problem that we are trying to address. So we have noticed that there are increased levels of anxiety and depression among college-age students, particularly females, but especially among our nursing students. This is mainly due to the high-stakes exams and high-stakes tests that are required for nursing students to pass throughout their time in college, and also in order to gain the ability to practice upon obtaining their degree. We also understand that emotional intelligence, that is defined as one's ability to recognize, manage, and use one's emotions, has shown to predict one's mental health, well-being, and perceived stress. Emotional intelligence is directly related to general anxiety disorder and depression. Further, emotional intelligence has been found to buffer the effects of stress to reduce one's overall well-being and burnout. Although the connection to emotional intelligence and mental health is strong, there is a lack of evidence regarding how to increase one's emotional intelligence ability. So because we do understand this connection between emotional intelligence and mental health, particularly anxiety and depression levels, we decided that we would try to implement a program, a cognitive behavioral therapy program entitled Mindstrong, which is a 7-week manualized program as a means to intervene and decrease anxiety, depression, and increase emotional intelligence amongst our nursing students at Miami University. And the goal of this program would be that nursing students who participate in the program will exhibit enhanced emotional intelligence, thereby lending to decreased anxiety and depression levels. We plan to perform baseline assessments. At midpoint, we'll perform an assessment of anxiety and depression, and then upon completion, we'll perform an emotional intelligence survey to evaluate if this program did increase the emotional intelligence levels amongst the participants, particularly because there are not a lot of evidence-based programs that tend to do that in the research currently. So this is just an overview of our project. Please feel free to reach out to either myself, Tricia New, or Jennifer Rohde, who will be my partner in performing this project.